My name is Kim Welter, and I facilitate the Ohio Health Modernization Movement, known as OHMM, and whose mission is to modernize the criminal code around HIV in Ohio. Brian Jones, the founding member of OHMM, was to have joined me up here today from Cleveland, but he is unable to make it, but his remarks are in your press packet about the founding of OHMM. However, as are most of the speakers' speeches as well. The OHMM members, who you see here in the red t-shirts, are here to celebrate the introduction of HB 498 and HB 513, sponsored by Sarah Brothers. But I want to move quickly on to our speakers, so I'm going to turn this over to Dr. Ashley Lips, who's an assistant professor in the Division of Infectious Diseases at OSU. Dr. Ashley?
Thank you. So good afternoon, everyone. My name is Dr. Ashley Lips. I am an infectious disease physician at Ohio State University, and I specialize in taking care of people living with HIV. So I am here today to support the passage of HB 498 and HB 513. The science around HIV has come a long way over the past several decades. What was once a fatal disease can now be managed with effective antiretroviral therapy, allowing people to live long and healthy lives. We have also developed very efficacious medications to prevent HIV in those who may be at increased risk. And we have also learned things like that when a person with HIV is on antiretroviral therapy and has an undetectable level of HIV in their blood, that they cannot transmit the virus to others. Despite these advances in research, despite the advances in research and understanding, there's much work that still needs to be done. We have learned what it takes to end the HIV epidemic in the United States, and this includes things like improving access to HIV testing and preventative services, and ensuring that all people living with HIV are maintained on effective antiretroviral therapy. Laws that criminalize HIV are based on outdated information and are rooted in stigma, not science. People have been charged with crimes for things that have posed no risk for HIV transmission, such as spitting. And it has been shown that HIV criminalization laws do nothing to reduce HIV transmission in the community. In fact, these laws can be counterproductive to efforts to end the HIV epidemic because they can discourage people from getting tested and knowing their status due to fears about potential legal liability. Perpetuation of stigma can also prevent people from accessing HIV prevention medications and prevent people living with HIV from getting the care that they need. What I want to reiterate is that there is going to be no compromise to public health based on the passage of these laws. The blood supply will remain safe. It will continue to be tested for things like HIV, hepatitis B, and hepatitis C. But what we'll be doing is moving forward together to work together to end the HIV epidemic in the United States and here in Ohio. The science is ever changing. What we know today is more than we knew several decades ago, and it's time that we update Ohio's laws to reflect the current data. Together we can work together, and we can focus on evidence-based strategies that will help eliminate HIV and reduce counterproductive punitive laws targeting people living with HIV. Thank you.
Thank you, Dr. Lips. Our next speaker is Dr. Olivia Nathan, who's a public health pharmacist.
Good afternoon, everyone. My name is Dr. Olivia Nathan, and I utilize she, her pronouns. And I stand here today as a Black woman first, and I want to say that again. I stand here today as a Black woman first, and secondly, as a public health pharmacist who is motivated to dismantle health inequities experienced by my patients in the broader community. I have spent the majority of my career working in HIV servicing organizations and currently work at one of the largest FQHCs in the state, leading our HIV prevention and treatment efforts. It is from this lens that I have experienced the disproportionate impact of HIV criminalization laws in Black communities, disparities in access to PrEP, limited access to substance use and mental health services, and unstable housing, all of which lead Black communities to experiencing poor health outcomes. HIV should not be a criminal justice issue, but rather a create a world where people living with HIV can live dignified lives free from stigma. Repealing HIV criminalization laws is one of my most passionate advocacy efforts. These laws worsen the end to HIV-related stigma and ending the HIV epidemic. It is my belief that in the 1980s, legislators were well-intentioned when creating these laws. There was a lot of hysteria fueled by fear, absent of scientific understanding of how HIV was transmitted. And this was long before we had advances in HIV treatment and before undetectable was untransmittable. However, what we know now is that folks can maintain an undetectable viral load, and as a result of that, HIV cannot be transmitted through sexual activity. These significant advances in science certainly validate any effort to update the law in this space. HIV criminalization does not exist in a vacuum and is a part of a larger spectrum of criminalization that often disproportionately affects Black and brown bodies. And in 2020, the pandemic shined a light on the experiences and challenges of policing and the targeting of marginalized persons in every other aspect of their lives, and these current laws merely add HIV status to that long list. The UCLA School of Law Williams Institute, which is a unique research institution to support the data to determine what HIV laws look like on the ground level, states that HIV criminalization sits at the intersection of two epidemics, HIV and overpolicing. Black people are more likely than their non-Black counterparts to be arrested and convicted for HIV crimes. They also face longer sentences after conviction and are more likely to experience the lifelong consequences of felony convictions. HIV criminalization is not being experienced equally by all people in our state. Black people were 44% of people arrested for allegations of HIV-related offense, although they were only 13% of the state's population. We can end HIV and the HIV epidemic, but we cannot do this until we end HIV criminalization laws. So House Bill 498 and 513, in my opinion, are steps forward towards Ohio's efforts in ending the HIV epidemic. Thank you so much for your time.
And we will get questions when everybody's done, but thank you, Dr. Nathan. So our next speaker is Nathaniel Albright, infectious diseases trained nurse practitioner and Ohio chapter president of the Association of Nurses in AIDS Care. Nathaniel?
Thank you, and I'm honored to be here, and I'm honored to speak alongside two phenomenal female doctors who I have the pleasure of working with. So this is a great opportunity. So good afternoon. Again, my name is Nate. I use he/they pronouns. As a dedicated healthcare professional and researcher committed to the well-being of all Ohioans, I stand before you today in support of the modernization of the state of Ohio's laws that criminalize people living with HIV through the support and passage of House Bill 498 and House Bill 513. For far too long, antiquated Ohio laws have unjustly targeted individuals living with HIV. These laws perpetuate stigma and hinder healthcare professionals and public health advocates' efforts to effectively combat the HIV epidemic. Not only do these laws fail to reflect current scientific advancements, but also contribute to discrimination, fear, and misinformation surrounding HIV. It's crucial to recognize that HIV is not a crime, it's a health condition. Treating it as such means adopting policies that are grounded in the current evidence-based approaches and human rights principles. Recent examples of HIV criminalization, such as the case of K-Mayor Weaver, highlight the disconnect between the science, the current laws, and how they are enforced. By modernizing Ohio's HIV criminalization laws, we have an opportunity to promote public health, support individuals living with HIV, and foster a more inclusive and compassionate community for all Ohioans. The consequences of outdated HIV criminalization laws are profound. They deter people from getting tested, disclosing their status, and accessing necessary care and support services. Furthermore, these laws are used disproportionately to discriminate against already disenfranchised groups living with HIV, including women, LGBTQ+ individuals, and racially minoritized Ohioans. House Bill 498 and 513 are a monumental step forward towards Ohio's efforts to ending the HIV epidemic. These bills as written align with the current science, which overwhelmingly supports the fact that people living with HIV who achieve and maintain an undetectable viral load, the amount of HIV in the blood, by taking antiretroviral therapy as prescribed, cannot sexually or perinatally transmit the virus to others, colloquially known as U equals U. I urge lawmakers and policymakers to prioritize the modernization of Ohio's HIV criminalization laws by supporting House Bill 498 and 513. We must replace punitive measures with approaches that prioritize public health through prevention, education, and support. By doing so, we can dismantle stigma, promote justice, and move closer to ending the HIV epidemic once and for all. In closing, let us remember that our actions today will shape the future of HIV advocacy and healthcare in Ohio. Together, let's stand on the right side of history by advocating for laws that reflect our shared values of compassion, dignity, and equity, and align with the current science. Thank you.
Thanks, Nathaniel. And to finish our press gaggle today, I'm turning it over to Randall Moore, who is also an OHMM member, although he's dressed in a suit today. But Randall, do you want to join us?
And we will open it up for questions.
Yeah.
Good afternoon, everyone. Thank you all for being here for such an important afternoon. My name is Randall Moore, based in Dayton, Ohio. And I stand before you today as a person living with HIV. And I'd like to take just a few moments and share why working on the support of HB 498 and 513 is critical to the other necessary work that will ultimately help to end the HIV epidemic. As a person living with HIV for the past 17 years, I have experienced many different stigmas as it relates to the Ohio law and the current laws that are in place, which has helped aid in my sometimes not wanting to share my status with individuals for fear of the repercussions that currently are on the books as they stand. I also have spent the past 8 years working professionally to help prevent and treat HIV through community engagement, education, and advocacy efforts, and working to raise awareness around many different issues that help keep our work stagnant. In that time, I have worked directly and spoke directly with patients and clients who have shared many, many heartbreaking stories with me and other colleagues alike, how they too have felt the backlash of shame, stigma, and guilt. As such, I am here today to share that the HB 498 and 513 will help encourage all of us to move closer to a day and time where we will see no new HIV infections. And that's a personal and professional goal of mine. I appreciate you all for joining us today to help uplift this very important work. I thank you all for being here.
Thank you, Randall. I really appreciate your participation today, so thank you. And to everybody else, thank you so much. Really appreciate it. Before we move to questions, I do want to note that if you would like to interview any of our speakers further after today, or there are some other people listed, including Corey Paul of the Ohio Red Cross, is listed as being willing to take interviews today. Please go through Clara Strode, who's the contact on the press release, to get in touch with him. Corey is more than willing to talk to reporters specifically today. So, questions then, and I'll bring people back up if you want to ask some specific questions.
In general, how do you expect to be able to pass these bills given the current climate in the legislature?
We are always hopeful that we can pass these bills, but we all know this may take a few years, and we are willing to stick together and do this work and make sure that we eventually repeal or modernize all 6 of these statutes so that people living with don't have to live in fear of being criminalized.
And if I could just add, I think that, what we have seen is an appetite for smart criminal justice reform, and I think this is right in line with that. So, we do have a highly partisan, situation on our hands, but we do have faith that they will see this for what it is, which is ultimately a criminal justice reform.
Other questions?
Why break the two into 2 different bills? One seems embedded in the other, right?
I believe that was our sponsor's choice.
Some might be surprised that this is a Republican-sponsored bill. Can you speak more to that?
You want to do?
Sure. I'm sorry. I'm trying to not stick my head in. I think that when we approached Representative Carruthers about carrying this bill, she immediately was on board because she had her own personal experiences with, friends who had been lost because of HIV. And so she appreciated the difficulty and the biases and the potential prejudice. So she took this up, and we're grateful that she did.
Can you talk a little bit about the education that you think might have to go into this for lawmakers? Because 513 is hundreds of pages.
Yeah, it's hundreds of pages, and a lot of it doesn't contain any changes, but in order to get them all, it's 100 and some pages long. Yeah, I mean, basically, we need to do the education that these amazing medical professionals just did here and get that out about, the modern understanding of science so that our legislators come out of the 80s, right, and into the 2020s around, HIV medication, U equals U, PrEP, everything that they may not know about right now. We hope that we do get that chance. We have sponsor testimony where we can present some of that. Hopefully we get proponent testimony where we can get some of that. We've had years of experience doing a lot of webinars around education to various AIDS service organizations, social workers, prosecutors, various lawyers, in trying to get them educated so that they are responding better when they're looking at cases themselves. Go ahead.
I have a question around Representative Carruthers and not being up for the election, I heard. So how will this bill how will the momentum continue in the next?
Yeah. We believe there are others
Okay.
that will pick up this bill next year.
Have other states made these changes?
Yes, there are a number of other states that made these changes. Indiana, Michigan, Nevada, Iowa, Colorado. Keep coming. California.
So what's taking Ohio so long? Is it willful, or are they just?
Actually, they did address it back when they had the whole recodification committee years ago. But of course, not a whole lot in the recodification committee report has been taken up. But it was addressed at the time, not quite to the extent that we've taken it, but several of the recommendations that we're currently making, plus more, were recommended at that time. I think it just hasn't had the opportunity, and we hope to create that opportunity, whether it's this year or next year, it'll happen.
We are getting to the end. I know it's only May, but we're approaching the end. You are prepared to continue all this in the next session?
We are. Yes. We are all dedicated to seeing this through to the end. Anybody want to add anything?
And some of us have been on this committee like for 8 years already, educating everybody and stuff, as much as we possibly can, on our personal time and on our business, at our workplaces and stuff. We have been, just telling people about it, doing outreach work where we can. Personally, as a person, I'm living with HIV, and these laws right now, I was almost prosecuted 2 times, sent to jail, for just women touching me.
Can you repeat the question? I didn't hear.
They're talking about carrying this, continuing on with the effort until we pass the laws. Like, are we willing to do that?
add to that.
Okay. This is Linda Irwin, founding member of OHMM. This is Francesca Schumann. What would you like to add?
What I want to say about ending these laws and modernizing these laws, as a person who has lived with HIV for 25 years, and not just a person, but a trans person living with HIV for the past 25 years, what I want to say is many times when we focus on someone's trinity, quality of life, which is their mental, spiritual, and their physical health. However, and these laws currently impact one's socioeconomic status. They can impact one's ability to date, one's ability to be able to make friends, make quality friendships, because many times when someone receives their HIV positive diagnosis, when you tell someone you have just tested positive for HIV, and the conversation ends there, and that person begins planning a funeral because of beliefs that have been passed on from the 80s, and we need to show life continues. You can have a productive life without laws interfering in your productivity of life, because these laws prevent people from having healthy, quality, stable, loving relationships.
And can I add a little bit to what you were saying about, dating and everything? I've been married now for 27 years. I've been HIV diagnosed with AIDS 25 years. My husband is negative because of U equals U. Also too, everywhere I go, I have to tell somebody my status because they could use it against me at any time. So for my protection, I tell my status to anybody, even in places I should not have to tell them. If I go to a bar or something, just to have a casual drink, I have to tell my status to people, or they will backstab me and try to prosecute me like one lady did. So yeah, it's a danger to our lives too, of where it's safe to disclose our status. And who should we disclose our status and when?
Can I add something, Kim?
Sure.
To me, this law really, really needs to be changed because I was prosecuted because of it. I spent 5 out of 8 years in prison because of the laws the way they are now. And if they were changed, a lot of things would be different. And the way that that we are treated out here, it's worse in there. So for these laws to be changed to protect us in and out, they really do need to be changed. Because now the law reads, it is a felonious assault. Now, for me to get a home, an apartment, yeah, they see felonious assault, they don't care what it's behind. They see felonious assault. Getting a job? No. I couldn't even get a job at McDonald's because I've got a felonious assault. And again, they don't care that it was because I'm HIV positive. They care that it says felonious assault. So yes, please, these laws need to change for the better for all of us.
This is Kelly Bean. Any other questions? All right. Thank you, everyone, to our speakers. Thank you. Thank you,